Ever wondered how a chest X-ray or CXR works? It's a crucial yet simple and effective examination that we're going to explore today. Like a window into the human body, a CXR is a non-invasive way for doctors to visualize what's happening inside your chest. It's a fundamental tool in the medical field, allowing for the diagnosis of a wide range of conditions, from lung infections and tumors, to heart enlargement and fractures of the ribs or sternum. With just a quick exposure to a small dose of ionizing radiation, we can produce images that reveal the structures within your chest in stark black and white. It's a fascinating process, one that combines physics, biology, and technology to help keep us healthy. Now that you know what a CXR is, let's dive into the different views it offers. A CXR provides us with several standard views, each with its unique benefits. Let's start with the posterior-anterior, or PA view. It's called so because the X-ray beam travels from the back to the front. This is the standard view where the patient's anterior chest is placed against the film plate to minimize magnification of the heart size. Next up is the lateral view. This view gives a better visualization of the retrocardiac space and the thoracic spine. It's also more sensitive at picking up pleural effusions, which are excess fluids that build up in the space between the lungs and the chest wall. When combined with the PA view, it's particularly helpful in localizing lesions. The anteroposterior, or AP view, is typically used for bedridden patients. The X-ray beam travels from front to back, and it generally results in a lower quality film than the PA view. One of the key features of this view is that it can cause an enlarged image of the cardiac silhouette. The lateral decubitus view is another one used for bedridden patients. It's especially useful to assess for pleural effusion and pneumothorax, which is a collapsed lung. Lastly, there's the Lordotic view. This involves an angled beam, which allows for better visualization of the apices, or the pointed ends of the lungs. These are normally obscured by the clavicles and anterior ribs in other views. Each of these views plays a crucial role in the interpretation of a chest X-ray. They provide a comprehensive picture of the chest area from multiple angles. This is vital as each view can reveal different aspects of the chest anatomy, and combined together they provide a thorough examination of the thoracic area. These views help doctors to visualize different aspects of the chest area, making CXR a versatile diagnostic tool. When doctors approach a CXR, they follow a structured process to ensure a thorough examination. This process begins with the basics. Clinicians first verify the patient's identity using the name, medical record number, sex and age listed on the X-ray. They then check the date of the exam and look for markers indicating the right and left sides of the body. The technique used for the X-ray is also noted, such as whether the view was posterior-anterior, anterior-posterior, lateral, and whether the patient was supine or erect during the exam. The indications for the study, or the reasons why the X-ray was taken, are also reviewed. Next, if available, the current study is compared with previous X-rays. This comparison can highlight changes over time and provide valuable context for the current findings. The quality of the film is then assessed, looking at factors like the level of inspiration, penetration, and rotation. Once the basics are covered, doctors move on to the analysis. They look at any tubes or lines present, checking their position and being alert for signs of pneumothorax or pneumomediastinum. The soft tissues are inspected next, including the neck, axillae, pectoral muscles, breasts or nipples, and chest wall. Then the abdomen is examined for signs of free air under the diaphragm, air fluid levels, and distension in the small and large bowels. The bones are also scrutinized, including the cervical and thoracic spine, shoulders, ribs, sternum, and clavicles. The mediastinum, which houses the heart and great vessels, is evaluated next. Here, doctors look for signs of cardiomegaly, tracheal shift, a tortuous aorta, or a widened mediastinum. The hilum, or the area where the bronchi, blood vessels, and nerves enter the lungs, are assessed as well. Finally, the lungs themselves are examined, including the lung parenchyma, pleura, and diaphragm. Doctors look for abnormal lung opacity, pleural effusions or thickening, and compare the right and left hemidiaphragm. This systematic approach ensures every part of the chest is examined and nothing is missed. Understanding the anatomy shown in a chest X-ray is vital for localizing lesions. Now, let's delve deeper into an essential tool for this task: the silhouette sign. When we talk about the silhouette sign, we're referring to the loss of normal interfaces in the lung due to pathology. This could be consolidation, atelectasis, or even a mass. It's like when you're trying to view something through a foggy window. The clear lines and forms you typically see are blurred or lost entirely. Now you might wonder, how can this help us locate disease? Well, each lung segment has particular interfaces with other structures in the chest. When normal lung tissue is replaced by something else, say, a tumor or pneumonia, it causes a loss of the normal silhouette. Consider it as a game of hide and seek. The disease is hiding, and the silhouette sign is your clue to its hiding spot. If the right heart border is obscured on a chest X-ray, the pathology is likely in the right middle lobe. If the left heart border is obscured, the pathology is probably in the lingula. By understanding these signs and the anatomy presented in a chest X-ray, medical professionals can play detective efficiently. They can detect and locate various diseases, enabling them to provide the best possible care for their patients. By understanding the signs and anatomy presented in a CXR, medical professionals are able to detect and locate various diseases. Chest X-rays are an indispensable tool in modern medicine. We've journeyed through the different views of a CXR, from the standard posterior-anterior and lateral to the specialized Lordotic and lateral decubitus. We've delved into the systematic approach to reading a CXR from basics to detailed analysis, and we've learned the importance of understanding anatomy for localizing lesions. With this knowledge, you now have a deeper understanding of the versatile and vital medical tool that is the chest X-ray.